Right, hello Ben. I'd like to introduce Ben Tung, who is the head of sustainability at NHS Digital. Ben, it's great to have you here with us. Thank you so much for joining us. So what I'm really interested in hearing more about is that we've heard a lot about the benefits of digital services and remote consultations from Shanti and Andrew. But I've also heard that there is actually a carbon footprint as well of digital services. And so I wonder whether you could just tell me a little bit more about that.
Yeah, hi there, thank you. Yeah, that's right. So up until very recently, the sustainability and carbon impact of digital services was a really hidden topic. So one of the pieces of work that we're doing at NHS Digital at the moment is starting to have a go at creating what we're calling net gain assessments, where we look at what's the overall sustainability impact of our digital service delivery. So that obviously includes looking at the impacts or costs in inverted commas of running the infrastructure and hardware systems that are required to send data around so that digital systems work, versus the enabled savings, because everyone knows that digital systems, as we've heard, can enable all kinds of efficiency benefits. So that's kind of headline thinking.
Great, thank you very much, Ben. It's good to know that that work's going on. So I'd really like to hear a bit more about what makes up the carbon footprint of digital services in healthcare in particular. That would be really interesting to hear about.
Yeah, absolutely. So I'm going to talk about this mainly from a kind of digital a data service provider, because that's our angle at NHS Digital, although I think this will be relevant to the broader healthcare sector as a whole. I guess the difference is that most of our services run on sort of fairly standard end user devices, whereas some of the digital services that are very for specific medical applications can be quite specialist. So they're a bit more difficult to get some of the data on. But broadly speaking, we can categorize into three areas. And those are data hosting, so data centers or servers if you're running a smaller facility, the networks that data gets sent through, and those will either be kind of wired networks or in some cases mobile phone networks, and then the end user devices themselves. And for each of those, you know, there's some headline kind of ideas that I could give if you'd like to, just to flesh out some of the questions that we could look at how to minimize impact for those areas.
That would be great. Thank you, Ben.
Okay. So in terms of hosting choices, which is a big impact area for a data service provider like NHS Digital, there's some clear benefits from moving to either very efficient co-location facilities. There's public sector contracts and frameworks out there to enable you to do that, or to, generally speaking, to move into the cloud is a cross-government policy. So the cloud, for those who are unaware, is where you don't have your own facilities, you sign up with one of the major providers to essentially sort of buy a package deal, and they look after the infrastructure for you. There are some issues around some of the data transparency that we're working through at the moment, but there's some very easy steps that can be made there in terms of a quite significant step reduction in carbon footprint, because some of the cloud providers have carbon neutrality for the energy that they use to power their facilities. So there's an easy quick win there. I think another kind of key area is data retention as well. So, you know, in the health service, we have some really strict guidelines around how long we need to keep stuff for. Now we're in a digital realm more and more. You know, are there real questions that we could be asking around how long data needs to be kept for, or how deep into archive we're putting stuff? If we can redo a scan or something quite easily, could we think about, you know, whether stuff needs to be kept for many, many years? Is that a viable question? Perhaps.
Is that because that all has a carbon footprint, that storage? Is that what you're suggesting? Yeah.
Yeah, absolutely. And so in terms of like data resolution, the higher resolution image that you send or store, then it can be very, very significant.
Yeah, so there's the high storage requirements for very high resolution CTs or MRIs, for example. That's going to be quite a heavy load in terms of energy. Yeah. Interesting.
Yeah, especially because they take so many pictures.
Yes.
Through, so storing them for a long time, is gonna have a big knock-on carbon footprint. And I think in the post-COVID world that we live in as well, there's a real question around video resolution as well. So video is actually the bulk of what gets sent over the internet, and that has a substantial footprint itself. So we could be asking, proper questions about what res we're setting our videos at for, say, telehealth and these kind of things. No, obviously, we need to be wary of experience and healthcare outcomes and all of this kind of thing as well. But I think there's an argument for putting it into the pot from a sustainability angle too.
Interesting.
And then the final category, end user devices.
Yes.
So thinking about this from a sort of standard user angle, phones, laptops, tablets, this kind of thing. I mean, the kind of key things to think about are making sure that we've just got one device where possible, and we're not having to have different devices for different purposes. Ideally, this would be a low energy device as well. So there's various accreditations that you can look to, EPEAT or TCO about there. So there's some fairly simple stuff there, but there's not only that, there's also a range of embodied impacts which we could consider with end user devices as well. I don't know if you'd like me to explore those a little bit.
That's really interesting. So yeah, thank you. I think let's go on and do that in a minute. So just reflecting on what you've said. So so really, when we're thinking about the carbon footprint of digital services in healthcare, we're looking at three areas. I think you said it was the data hosting, so that's around either the servers or cloud use. You've got the actual networks, which is automatically sort of the physical networks really, and then the devices that we use. Those were the three areas. That's really useful, I think, to have that to have that framework. Thank you so much, really helpful. I would like to hear a bit more about those sort of what you call embodied impacts, the impacts that we have based upon the actual devices. That would be really interesting. Yeah, could you tell us a bit more about that? Thank you, Ben.
Yeah, absolutely. So one of the key things that we need to think about here, if you look at it from equipment from a life cycle perspective, is what damage happens upstream and downstream, but predominantly it's upstream in the manufacturing process.
Manufacturing is a key element.
How can we limit that? So, absolutely. So, especially in the world that we live in at the moment, where equipment only has a life cycle generally of a few years in active use, the manufacturing impacts are very significant. So to give you some kind of rough idea, it's about 80% of life cycle energy for an end user device like a phone or laptop is in the manufacturing phase. So no matter how energy efficient it is, the majority of the energy has already been taken up anyway. So you're kind of fiddling around at the edges a bit. So hopefully that kind of shines a light on the importance of this topic. But it's not just energy and carbon, of course. There's a range of other upstream impacts which need careful consideration. So for ICT, you've got rare earth metals, and those are a non-renewable resource which will run out, but they also cause huge amounts of ecological and social damage in their extraction. Yeah. So, I mean, there's all kinds of modern slavery and other issues in the social realm that need managing carefully. From strip mining, you've got conflict minerals and stuff in there as well. And then
conflict minerals. What do you mean by that?
So some minerals which are being taken from war-torn areas, essentially. So which are poor ethically. So but we have So there's a place in Mongolia that is touted as being the most polluted place in the world, which is a lake which is used for rare earth metal refinement, and it's all the waste from that processes, and all the local town and local ecology has been completely destroyed by rare earth mining and refining. So that's obviously horrendous for the people and the ecology there. And that's really a topic which very few people think about is, you know, digital is a means rather than an end to achieving better life, and in our sector, better healthcare outcomes. But what impact is our digital equipment manufacture having on ecology elsewhere around the planet, I think is a really important link that we should all be making and thinking about.
And also the health of those other people as well, in that sort of in distant places distant from us. Yes.
Yeah, absolutely.
Really interesting.
So really kind of what a lot of this pushes towards as a kind of action point is starting to think about circular economy solutions. So for those listeners who haven't thought about circular economy before, it's essentially a way of getting multiple usage lifetimes out of bits of equipment. And to do that, you could be thinking about how can we have equipment which is repairable, modular, upgradable, this kind of thing. We can think about how we could switch to leasing contracts over ownership, because that starts to push many of the incentives for the equipment manufacturers towards making stuff that doesn't break after a few years that we have to throw away, in essence. It's a growing thing. If you haven't heard of it before, Google it. There's tons out there, and there's some great examples like Fairphone, who make really good circular phones, and I also sit on a group that are looking at circular economy in the data center industry as well, trying to help people who are buying servers make more circular decisions in that space. So, you know, it's quite an exciting area that would make a step reduction in the entire range of embodied impacts, because you only have those embodied impacts once in the manufacturing process then, so you can create orders of magnitude of savings.
Fantastic. That's really helpful. So just reflecting on the key points that I've taken away from that are that about 80% of the carbon footprint of a product is about the manufacturers, the manufacturer. So that's why you're saying that we need to be pushing towards a model of circular economy where we're not looking to recycle, we're looking to actually reuse the product at the same for the same purpose essentially that it was designed in the beginning. And also just mentioning there that there's also some considerations for social sustainability in the manufacturing around the health of those people and the well-being of those people in the supply chain, and also apart from the carbon footprint, the integrity of the local environment and local ecology. It's really interesting. Thank you.
Yeah. My pleasure.
So I suppose that it was quite interesting you talking about looking at the circular economy for devices. That sort of really brings on to my last question, really, was wondering what other ways could we think about to maximise the benefits of digital health service and really minimise those environmental and social costs in particular, and obviously financial as well, but that's well considered, I think. So I wonder what your thoughts would be on that, Ben, from your experience.
Yeah, of course. So, I mean, I'll just give you a few little thoughts around this, the other side of the net gain angle. So far I've been talking about how do we reduce the impacts of the infrastructure itself, but how can we maximize the savings downstream, I think is a more, in a way, it's a more complex question because it involves a lot more stakeholders, and getting hold of some of the data is a bit more difficult in terms of measuring success, but I'll talk principles for now. So
is this also, are we thinking about this is where clinicians can make a big difference as well in how they design their pathway, their sort of services? Would that be true? Would there be an opportunity here, do you think?
Yeah, and I think for me there needs to be some quite in-depth discussion around how do we do this, because and it really does have to be a kind of whole cross-system partnership to be able to make sure that the right considerations are getting designed in and then deliver, so we can deliver against them right through right through that pathway. So just a kind of some headlines, I guess, for you.
Yes.
Clearly, it's a bit of a long word, but interoperability, getting all our systems to talk to each other, is a bit of a silver bullet in this space. Through that, we can start to move towards more smart systems, smart hospitals in this case, where we can leverage out some really significant sustainability efficiency improvements, but also start to get some co-benefits around patient experience and patient flow, and linking the different health facilities within the different health services within a facility, to start to fundamentally enhance healthcare outcomes on top of everything else.
So could you give an example of that, maybe, just to give us a sense of? So I think you're saying that you want all the systems, perhaps within a healthcare system. So in the integrated care system, perhaps to be talking to one another. So you've got a good flow of information across that area and across those different services that make up that place. So we can have presumably linked through to better patient care through that better communication. Is that the kind of thing you were thinking of?
Yeah, so I mean, I've been talking to some of the people involved in the HIP program, looking at the new hospital construction projects which are coming up, and some of them are looking at smart hospital ideas. So, you know, a dream would be that a patient arrives at a hospital and their mobile phone kind of talks to the building management system, and it tells the building that the patient has arrived, and they just get something popping up on their phone telling them where they should go to. And then the building knows that they're there, and so therefore can start to coordinate all of their different appointments that they'd have on site, and they can do everything in less visits, so lowering travel emissions, you know, freeing up time for everybody, hopefully. And you know, traditionally this kind of smart stuff has been looked a bit more at energy management. So of course you'd be looking at how do we do that, but there's so much more that we could do within actually the health journey that people have, with the fundamental outcome that if everything's quicker and smoother, that less significant illness will develop. So yeah, I think the benefits are huge, and so much of this is about not kind of reducing down sustainability into different areas. It's to look at the broader range of co-benefits, because the business cases get so much better then as well. And if we're trying to improve things across a range of measures that we're worried about.
Yes, it's about integrating. It's all about integrating it, isn't it? Looking at the patient pathways and integrating digital into that in a really thoughtful way, I think. Yeah, absolutely.
I mean, another example there is like app-based treatment. So NHS Digital have got the Nhs Apps Library, and if you think about kind of like healthy lifestyle apps, for example, you know, what kind of benefits could they have for ill health prevention and health inequality? I think it's really significant. Now, you do have to be careful in this space, because there's issues around standardizing stuff so it works on older devices as well, because otherwise you can start to enhance things like digital exclusion. So you could accidentally enhance health inequality.
So if someone can't afford the latest update, and they've got an old Nokia that is not a smartphone, for example, it sort of excludes those people, maybe. Yeah,
exactly. But yeah, the benefits are huge. Of course, we've got all kinds of AI systems starting to come through now, and those are going to have huge benefits too. There's already examples of AI in active use, I know, in things like radiology, and there's some examples of GPs using artificial intelligence triage services, aren't there, for healthcare, for helping route people through to the care that they need. So that's already happening. You know, again, that's an area that does have a knock-on sustainability impact, though. So machine learning can have a very, very high energy demand. So, you know, this, again, it's just an area where sustainability needs to be factored into a range of co-benefits, I think, to make sure that we design the right things in at the right point.
Yes, is automating something like that really in the round, in the holistic assessment, really of benefit? Yeah, interesting.
Absolutely, yeah. And just as a final thought from me, really, I mean, I don't want to be doom and gloom, but if you look at the environmental news, you know, climate change is starting to happen. You know, we're going to have to be thinking adaptation and resilience. And one of the things that I'm really keen to collaborate on is a question around how do we ensure that our digital healthcare services are resilient to the likely impacts of climate breakdown or climate instability, and how can we make sure that the digital and data services kind of maximize the resilience of the broader healthcare sector? I think it's going to become hot topic. So it's a very different kind of question to how do we reduce our sustainability impacts or maximize our benefits. But, you know, it's something we can't avoid, and I think it will be a growing area.
Yeah, that sounds very likely, Ben. Thank you very much for for highlighting that really important question that will be a really future hot topic. Thank you. And also for that really great summary, I think, going through, giving a sort of broader perspective from NHS Digital to complement our clinical views. Thank you so much.